With our guest in our studio in Abuja, Dr. Philip Ekpe. He is a medical practitioner and the chairman of the FCT CAP chapter of the Nigeria Medical Association. Dr. Ekpe, thank you for joining us on the News at 10.
Thank you very much. It's my pleasure to be here.
I would love to hear your how you rate the response to infectious diseases since the launch of the National Healthcare Development Plan at the beginning of 2019.
Yeah, thank you very much. One of the landmarks we must look at is, when you see infectious disease, we're talking about communicable diseases. And one of the landmarks is the fact that we're going to be declared polio-free for Nigeria. And looking at that, that tells you that government has really done a lot for us to achieve a polio-free nation. We are just among the few countries left to be declared polio-free, and Nigeria has just made that up. So I can say based on that, but if you notice, I mean, with the advent of Ebola in 2014, 2015, thereabout, Nigeria did very well. So I think Nigeria, to some extent, sporadically are professionals in combating infectious and communicable diseases. And we're there, and I think the rating is good. The only thing we need to do now is to strengthen the surveillance and the monitoring. And we should also strengthen the reporting mechanism so that isolated cases can easily be grabbed before it now spreads to other places. Also, the other things to do is for government to look at increased awareness, and apart from that, individuals and communities should increase their hygienic behavior. Then government should invest more on preventive medicine, public health. That way, I mean, we prevent most of these communicable diseases. Thank you.
Let's focus a bit on the practitioners, the doctors and the health workers who've been a little restive in 2019. What would you say is responsible for this? And what are the plans for better relations going forward?
Well, yeah, if you compare 2019 with the past, you realize that there's not been any strike or industrial action among doctors. And this is because a lot of engagement have been taking place, dialogues. We believe in dialogue, and we believe in that Nigerian patients are worth it. It's time to begin to think of how patients will benefit most beyond our welfare, though our welfare is very, very important. Yes, what I would say is that the restiveness is not because the doctors or the healthcare workers want to be restive. It's because of the slow response of government on its own part. Before doctors or health workers decide to go on industrial action, most times you realize that they will have had to write to government, taking up appointment, deciding to discuss and discuss and discuss over and over again in order to prevent industrial action. Unfortunately, governments seem to only stand up to it when they are given a threat that, within a so number of days or weeks, we are going to embark on industrial action. Then government stands up. Otherwise, there is no need for that. But then I will commend the doctors and the health workers for their patience, because, I mean, you discuss something probably in National Assembly, and they will give you a timeline that so time it will be implemented. And by that time, it's not implemented. We extend it to 1 month, it's not implemented. 2 months is not implemented. There's only a limit to which we can be patient. I mean, these are the reasons, but I don't think ordinarily doctors are restive. I'll give you an example: the payment of skipping arrears for doctors. I mean, well, it's beginning to come, yes, so we should commend government for that. But it took a whole lot. There is also the Residency Training Act, which is yet to be implemented. These are the things that are going to improve the healthcare of the nation. There are also other issues related to health that we have discussed with government, and they've given promises that are going to get something done. But at the end of the day, until you begin to push harder and begin to come up with, do you want us to drop to? That is only when government is standing up. So I will appeal to government that they should look more on implementation of the outcome of dialogues than waiting for when the doctors or the care workers will begin to say, oh, look, we want to embark on industrial action, and that is not the time to act. I think those are the few areas that we should look at.
And hopefully those who should be are listening at this moment. Thank you again, Dr. Philip Ekpe, the chairman of the FCC chapter of the Nigeria Medical Association, for joining us on the News at 10. And a Happy New Year to you. It's happening in just about an hour, I
Thank
guess.
you very much. Yes.